Do you have a weak memory? Do you feel like your memory is failing you? In this video, I'm going to tell you 10 causes of weak memory that, if not identified and properly treated, can even lead to dementia. So it's really important that you pay attention to all the causes so you can investigate. And I'll also tell you about some of them, how to solve them. Some causes you can fix in a simple way, while others will require more investigation and a proper diagnosis. So let's start with a very common cause of weak memory. Very, very common. I'm going to tell you it's extremely, incredibly common, and that's vitamin B12 deficiency. When your vitamin B12 levels are low in your blood, this cause here, it can happen for a number of reasons. Even as you get older, especially after age 60, your body can reduce the production of stomach acid, which is essential and necessary for absorbing vitamin B12. Some medications can also interfere with absorption, like metformin, omeprazole, pantoprazole, and esomeprazole. These medications that interfere with the absorption of vitamin B12. It doesn't mean that everyone who takes metformin or omeprazole, for example, will have a vitamin B12 deficiency. But it does mean that you need a check. So, whenever the topic is weak memory, or if you're experiencing memory loss, vitamin B12 definitely needs to be checked. That's mandatory because this is one of the causes. If it's not identified, it can progress and lead to dementia. It's an irreversible situation. You have a relatively simple and common situation, but by not knowing about it and not identifying it, it ends up becoming something irreversible and very serious. It can really limit your life, which is dementia. So, vitamin B12, how do you investigate this? The first thing is a blood test. Detect your vitamin B12 levels. There are other tests as well. I've already made a specific video about this. If you follow the channel, here's an invitation for you to subscribe. If you're not subscribed yet, and if you already are, don't forget to leave your like too. But I've already talked about this. In the other video, there are other tests that can detect an earlier vitamin B12 deficiency, like homocysteine and also methylmalonic acid. But this is a very delicate topic, so I'm going to focus here on evaluating vitamin B12 levels. Even if you're consuming it regularly, sources of vitamin B12, like meat, for example, animal-based foods, milk, eggs, even so, your body might not absorb it. You could have a condition that's making this worse. So, memory problems, check your vitamin B12 levels. Second cause, extremely common, which is a thyroid disorder. Did you know that thyroid disorders, especially when thyroid hormones are low, which we call hypothyroidism, can lead to memory loss? Often it's the very first sign. Did you know that? When I see patients with hypothyroidism, I'm a doctor, an endocrinologist, so I treat this a lot. I always ask, how's your memory? And almost all patients who have low hormone levels, a reduction in thyroid hormones, they say this. No, my memory really is weak. And I didn't seek help before because I thought it was just in my head. I thought it was normal. So here's a tip. This isn't normal, okay? Having a weak memory, constantly forgetting things, having it affect your quality of life, that's not normal. Of course, forgetting one thing or another. Oh, I forgot my keys. I forgot a certain phone number. Those occasional lapses, they're normal. There's no way you'll never forget anything. Now, when it starts to interfere with your quality of life, that's when you need to check your thyroid and these other causes I'm going to mention here. This second cause here, which is the thyroid, if it's not treated or identified, it can get worse over time. And it can also lead to dementia, which is a very serious condition. A very serious situation. So you need to assess and treat thyroid issues. Remember, the treatment is usually pretty simple, and you see a big improvement in signs and symptoms. So how is this evaluation done? There are two tests, routine tests, that we use for diagnosis. Whenever we're dealing with poor memory, these tests need to be done and evaluated, which are TSH, thyroid stimulating hormone, and also the blood level of free T4 hormone. It's not total T4. A lot of people get the total T4 test. That's not the best test when it comes to the thyroid, especially in this specific case, which is diagnosing hypothyroidism. So TSH and free T4, okay? And what about T3 levels? Well, for diagnosis, it's not really useful, all right? For this screening, in some specific situations, then yes, T3 can be checked, but for screening, it's free T4 and TSH. Got it? Reason number three, which is also extremely common, is sleep. How many hours a night are you sleeping? If you're sleeping less than 6 hours, that really can affect your memory, and it's extremely common, especially if you have a busy work schedule, small kids, or something that's bothering you, or any situation where you just can't sleep. If you have trouble falling asleep, for example, sleep issues like this are actually very common. So when I ask, start counting how many hours you're actually sleeping each night. And if the answer is less than 6 hours a night, that's gonna hurt your memory in the long run, even if you feel fine, okay? And now you might be confused, wondering, but wasn't it supposed to be 8 hours a night? Well, ideally, if you can get 8 hours, that's even better. I'm setting 6 hours here as a more realistic goal for most people. For example, I personally can't manage to sleep 8 hours a night. I try to aim for about 6 hours a night, okay? So some studies mention 8 hours, while others mention six. Here, I'm referencing the target that's easier to reach, all right? But if you've heard 8 hours, that's also correct. So you need to adjust this sleep issue. Cause number four, and this one is also extremely common, is medication. Did you know that many medications can directly affect your memory? I'm going to mention two groups here. The first group is these are medications that interfere by blocking acetylcholine. Whoa, that's some complicated language. But anyway, it's essential for you to have acetylcholine so you can form memories and keep your brain functioning well. And some medications end up interfering with this acetylcholine. Which medications are these? Some medications for overactive bladder, some antihistamines, and some antidepressants can interfere with acetylcholine. So if you're noticing your memory's weak, you need to check with your doctor, especially if you're taking an antidepressant, okay? There are over 100 medications that can cause this. I'm not going to list them all here, but it's important to review your medications and have a conversation about them. Can this medication affect memory? And there's another group, this one I'll name specifically, that's been proven that can interfere with your sleep and also harm your memory are the benzodiazepines like diazepam, lorazepam, bromazam, clobazam, midazolam, but especially here, clonazepam and diazepam, which are the medications most commonly used for inducing sleep, okay? Alprazolam is also very common, so you need to check the active ingredient. And there are a lot of brand names. I'm not going to focus on the brands themselves because what really matters is the substance. So you need to check which medication it is. If it's one of the ones I mentioned, if the active ingredient is that, either diazepam or clonazepam, then yes, you need to talk to your doctor to see if there's an alternative, okay? I know that sometimes it's hard to fall asleep. This can be an option, and often it's the path people take, but it's the easiest way out, and it comes with consequences, all right? Why? Because the architecture of your sleep can be compromised by these benzodiazepine medications, the ones I mentioned here. So it's extremely important to pay attention to this issue with medications. The first thing I look at, always in the first appointment, I always ask about this and try to find alternatives to replace any of these medications if possible. Just a reminder, the medications I'm mentioning in this video are just for awareness, for informational purposes only. I'm not against any of these medications like metformin. I actually prescribe metformin quite often, But since you're taking these medications, you also need to be aware of some of their effects, okay? So it's not that the medication is bad, but rather that the follow up needs to be done in a focused way. In this matter I'm mentioning here. Deal? The fifth cause is certain infectious diseases, such as HIV, syphilis, diseases that can cause meningitis, brain inflammation, and even COVID. Did you know that COVID can cause memory loss, even in the long term? So, these infectious causes should also be evaluated, okay? There are blood tests that can detect this, because number six is alcohol abuse. When I talk about this, when I'm talking with patients, I also notice that many of them have this idea that only people who end up with memory problems from drinking are those people who are out on the street already homeless because they drink too much. But actually, that's not true. Alcohol is neurotoxic. So, after a few drinks, especially for those who have the habit of drinking every day, this can affect your memory. First, because it disrupts your sleep, and as we've already seen, sleep is essential, and also because it can cause deficiencies. In vitamins, a well known one is vitamin B1 deficiency. So, with alcohol, you really need to check how your alcohol consumption is going. So, sometimes a person has a perfect social life. They do great at work, take care of their personal matters, and go to the gym. But sometimes they're drinking more alcohol than their body can handle. So it's not just that person living under a bridge. Let's get rid of that idea. It's a misconception. Number seven is neurodegenerative diseases, which are also a major cause. You can run every test and find nothing, and the person still has a weak memory. So, I want to point out here that some diseases also need to be checked, like Alzheimer's disease or vascular dementia as well. Another type of dementia, especially in people with high blood pressure. So, yes, these diseases also need a lot of attention because there are treatments available. For example, in the early stages of Alzheimer's dementia, there are treatments that can slow the progression of the disease, and the person recovers very well. I see this happen many times in my office. There's a big improvement in quality of life. Because number eight, and this one is also very common, is obstructive apnea, obstructive sleep apnea. What is that? During sleep, your oxygen flow gets interrupted, and this leads to a reduction of oxygen in the tissues of your brain. This also causes weak memory. This obstructive sleep apnea can cause a lot of things, like high blood pressure, and it can also raise your blood sugar levels. This is really important. It's crucial to evaluate sleep issues. So, if you snore a lot or if you wake up feeling like you're suffocating, actually, it's not just a feeling. You really are suffocating. Air isn't passing through the right way, and you're not getting enough oxygen. So, you need to get that checked out. With certain tests, like a polysomnography, you can detect this problem. So, if you have any of these signs I mentioned, if you snore a lot or someone tells you that you snore a lot, then you really need to get that checked out, okay? Because a lot of times, the only way to solve it is by evaluating your sleep, especially for obstructive sleep apnea. And I'm not just talking about weak memory here, but also about high blood pressure. It's very common. There are people taking three or four different kinds of medication for high blood pressure and still not getting any results because the root cause is in their sleep. Because number nine is chronic stress. And some disorders, like depressive disorder, when you have chronic stress, when you're really stressed out, you also have an increase in certain hormones like cortisol. And your brain can start working differently, causing this weak memory. So it's also essential to evaluate how things are going with stress, anxiety disorder, and depressive disorder. This is really important. And cause number 10, which is also extremely common, is high blood sugar levels. Diabetes. Did you know your memory can also be affected? That's something people rarely talk about, right? And when I diagnose diabetes or when I see patients with diabetes for the first time, I always ask about this. And many will say yes, that their memory is affected. And a lot of times it just gets brushed aside, doesn't it? So, how's your memory and your blood sugar levels? The point here is to work on lowering those levels to get them back to normal. And I've already made a video with natural tips to help you lower your blood sugar levels. There are a lot of tips here, and it's really important. If you have diabetes, make sure to watch this video here. If you don't have diabetes, I'll leave a recommendation about vitamin B12. Did you see that it can cause problems too? So here's a recommendation up here about vitamin B12. You're gonna enjoy it and learn a lot, I'm sure of it. Everything's backed by scientific authority. Take care. See you next time.